sticking around for our closing keynote that will follow just after this. We have 3 speakers with us for this session. First is Jen Brown. Jen is the co-founder and co-director of the Alliance for Research in Chicagoland Communities, ARCC, at Northwestern University. She is passionate about, ARC? I'm going to call it ARC, is that okay? ARC's work to grow and support authentic community academic research partnerships that honor, are driven by, and share power with communities to improve health and equity. Jen has over 20 years of experience building and supporting community academic engaged research partnerships at project, institutional, and multi-institutional levels through partnership brokering, capacity building, seed grants, storytelling, and advocacy. She is on faculty at Northwestern School of Medicine, Northwestern's Feinberg School of Medicine, Department of Preventive Medicine, and the Center for Native American and Indigenous Research. She serves on the Patient Engagement Advisory Panel for the Patient-Centered Outcomes Research Institute, Chicago Consortium for Community Engagement, Partnership for Healthy Chicago, Associate Editor of Progress in Community Health Partnerships Journal, 2020 inductee into Gold Humanism Honor Society, and was a Chicago United for Equity 2019 Racial Justice Fellow. Next is Candace Henley. Candace is the Chief Surviving Officer of the Blue Hat Foundation, Incorporated. She has over 18 years of tireless advocacy for colon cancer prevention and support. Her battle with colon cancer and its devastation on her life and her children inspired her to create the Blue Hat Foundation. The organization was built on unconditional support and compassion for people fighting colon cancer. Its mission is to provide education, information, and free screenings for colon cancer in the minority and medically underserved communities through community partnerships with healthcare providers, hospital systems, and FQHCs. And Mr. Melvin Thompson is the Executive Director of the Endaleo Institute. After spending nearly 2 decades in civic, private, and nonprofit world, he truly knows how to connect the dots in forging powerful relationships across multiple sectors for the betterment of far south side communities. The consummate relationship builder, he spearheaded a community-driven $10 million restoration of the Carter G. Woodson Regional Library and was instrumental in recasting it as the City of Chicago's first dementia-friendly library. So we've got some great, very well accomplished presenters among us here. If you have questions, please put them in the chat and we'll kind of go through them as the session goes. I'm going to go ahead and turn it over to you guys. Thank you.
Thanks so much, Heather. Good afternoon. We're so excited to be joining you virtually from Chicagoland. We want to talk about nothing about us without us and the principles of community engaged research. And we're into engagement. This kind of virtual thing where we can't see y'all and don't get to talk back and forth as much is not as what we're used to. So please fill up the chat with your comments, your questions, your suggestions. We know there's likely a lot of expertise in the room. So please join us in that way. And don't feel like you need to hold questions until the end. We'd be happy to have back and forth engagement. Next slide, Heather. I think we could go quickly through that because you did a great job of letting folks know about who we are. And here's, you'll be able to click on our organizations. As Heather mentioned briefly, we're here from the Alliance for Research in Chicagoland Communities. We started in 2008, and we're focused on partnerships that center and support and share power with communities or led by communities. And there's our website, and you'll see pictures from the before times and some of our outdoor gatherings during the pandemic of our partners and partnerships and our beautiful Chicagoland communities throughout the presentation. And we're and then the next slide. Thanks, Heather. In the same way that we know research is more impactful when it is done in an engaged, community-driven way, we know that's true for our program as well. We have a participatory governance model that's led by our steering committee, comprised of 13 community and faith-based organizations, 2 public agencies, and 10 faculty and staff throughout the Northwestern system and our clinical affiliates. And Melvin and Candace are both members of the steering committee. Next slide, please. if we want to impact communities with research at the end of the research, it's crucial to start with community in the beginning, where they are, what they're thinking, what they're seeking. We start with, asking you to be reflecting on these questions as we talk today, and again, joining in the chat or otherwise with your experiences about how do you think communities think about research, whether they're representing community libraries or other types of stakeholders or community members or patients themselves. Why would communities want to participate in or engage in research, or why not? How do communities see themselves represented in research? So we'll dig into this a little bit, but we really hope to hear from you as well. Next slide. We want to start with a foundation of how ARC approaches community engaged research. On the left-hand side of the slide, you'll see the principles of engagement. Our Center for Community Health spells this out, and there's something on our website that talks a little bit more about these 5 principles and how they're operationalized in this work: collaboration, respect, equity, transparency, and impact. Community engaged research is an approach to doing research that honors and centers the expertise that communities bring as local, cultural, practice, and lived experience experts in collaboration with academics in terms of being scientific experts to increase the value of research for improving health and equity. Next slide, please. In thinking about community engaged research and how it's an orientation to changing the roles of who is the researcher and who is the researched, ARC typically asks 3 core questions: who makes the decisions, who has the power, and what is the evidence that research has changed, or the design, the conduct, the findings have changed based on the community engagement. So this is in terms of who chooses the issue to be studied, who's on the team, who makes the budget, who makes presentations about what's learned or what's happening, who owns the data, who speaks to the media, who determines if the research was beneficial. Engaged research says we need to distribute the decision-making authority to those whose lives are most impacted by the research. And there's a few key principles located here. So we're going to have time during this presentation where we go back and forth. Melvin and Candace are the real stars here. And so I'm often going to open it up and see, based on what I'm saying, they will likely have some thoughts they want to add in. So I'll start that here. And if y'all don't, then you can just wave me on. Candace?
No, you're spot on. I think so often the phrase community has gotten so misconstrued, because now, before we knew that the community meant communities of color, disadvantaged communities. But now community, the phrase community is a buzz phrase. So you have to really now define what does community actually mean? And as you've shared before, who has the power in the community? And so often people in the community don't realize that they actually have a shared power. So this is such a great representation of that.
And with that, I'd just add that there's almost a research fatigue because of the onslaught of research in our community, that all of a sudden, we're starting to be, I think there was a publication a couple of years ago, why are we so, over-researched or something to that effect. And it's just, it really puts in perspective, why it's important not to come with an agenda as a researcher, because the issues that plague our communities are so complex and complicated and interrelated that there's a fatigue that sets in. So that'd be the only thing I'd add for researchers to be mindful of.
Thanks, Melvin and Candace. And I'm putting actually, I'm putting the link to that report that you mentioned, Why Am I Always Being Researched, into the chat for folks to see. Yeah, so when we wanted to bring this up, like, who is the community, who represents the community? If we had, a longer session, or we were able to be more interactive, we may hand you a blank, version of this stakeholder flower, to acknowledge that community is not a monolith, that community doesn't all speak with one voice, and depending what you focus on, or what impact you're seeking to have, that's going to look really different. So these are the types of, stakeholders that you may impact or that you may engage. But it's important to think about that and reflect on that. Art typically thinks about community in two ways. Who are those that are impacted by the issue or the topic that your research or your engagement is focusing on? And who are those that have the power to make change based on those findings? And those communities will likely overlap, but really thinking that through, and also knowing that community engagement is not about engaging a singular community or a singular type at a singular point, but it's a very dynamic process, and you will likely engage or should engage different types of community stakeholders at different points in the process. And that oftentimes, the third point on the right-hand side is also that it may be easier sometimes to engage with folks that are working on an issue as a part of their day job, as a part of their profession, as a part of a community-based organization, a public agency, or patient advocacy organization. They may typically have meetings at the same time that you do. They may have email or other resources, but that there is no substitute for engaging individuals that with lived experience with a health issue or a condition, and what that looks like. And also thinking keenly about who are those that are most impacted by inequities. Sometimes I don't like the phrase about like hard to reach populations. Populations aren't hard to reach. Researchers or others may be bad at reaching them or not set up, but Candace, you look like you have a point here.
Oh yeah, no, I mean, yeah, because I'm with you on that. It's not hard to reach, right? It's like what I consider is you're meeting too much. You're meeting too long about the same problem that has existed. So when you're talking about the same problem that has existed, but yet there's no movement, then yeah, it may seem like the populations are hard to reach because nothing has been done outside of conversations. So the conversations have to be intentional. There's no hard to reach populations. They're only hard to reach when there's no action behind it. So what's the action behind the work that you're looking to do? How long does it take to have a discussion about the work that you want to do before you actually put action behind it? So it may seem like communities are hard to reach because you keep saying, hey, we're going to do this, we're going to do that. And it's been 2 years because you're still talking about it. So now you're losing the trust from the community because they've been waiting, or you've been having these discussions, but yet no movement. So you have to be mindful about what that looks like, what your intention is, and how long does it take your intention to move? Because that doesn't show, that doesn't show intention. It just shows like running in place. So those are just my 2 cents that I have to add with that.
Yeah, and I'd add to that what I've learned in just working with researchers is that that's their currency, research, that's what they live by. So, swooping in and getting this grant and then working on the next one and then the next one, a lot of these communities have been researched, never hear about what that research actually, morphed into, and never hear back from the researcher to follow up and say, okay, this research turned into an objective, which turned into a policy, which now is going to be enforced. The disconnect is why the fatigue sets in, and then it's like, well, why should we meet, right? Because, to Candace's point, there's nothing concrete that is going to come out of this. And so understanding the nature of what drives researchers and what their currency is has to be tempered with the genuineness of engaging with the community and delivering, having deliverables for that community that will sustain them for the next time that you come back, looking to mine resources within the community. The last thing I'd say is, and I think Jen kind of touched on it about the monolith, and generalizing communities is a cardinal sin, right? Because if you look at this chart, there's so many different entities. I actually happen to represent community, but I also represent the faith-based institution, right? So we're coming at our issues from a completely different lens than maybe someone else, and so that needs to be respected and taken into account. And so you just want to make sure you're not painting the community with a broad brush. That's all. That's it.
And I would just add one more thing too, is making sure that you know the language of the community. So often, we are trusting others to guide us through this, but there's nothing, worse than being misguided, right? Because you didn't do your research for your research. So you depended on someone else to give you information, and you didn't validate that, the language of the community. What does the community say they need? What does the community say they want? Who's in this community? What language do they speak? What is the religion that they have? What are the cultural taboos? So these are things that you really need to take a long thought on when we're talking about community, because it's not a one size fit all.
And I'll just say, as a community leader or activist or whatever you want to call it, I'll go into a community meeting knowing that I want to talk about food insecurity or nutrition deficits. But by the time that meeting is over, I have heard about 4 other things that are higher priorities than what I came in there to talk about. So I can do one or two things. I can go tone deaf to that, or I can engage in that conversation and find out what truly matters, and then figure out a way to connect the dots with what I came to talk about. And that's what builds genuine trust in the community. When you've got both your ears and you're using them, because maybe this first visit I didn't get done what I needed to get done because the meeting went in a completely different direction. But you're going to be invited back because you listened, you heard, and you gave back to them what they gave you. I can't emphasize enough how incredibly important that is as a community leader in the community. And I even get surprised about, oh, okay, so, healthy fruits and vegetables is not issue number 1, right? It's maybe issue 4 or 5 because they're trying to keep the lights on in this community, right? So just fodder for consideration. Sorry about that, Jen. Move on.
Right.
No, that's a perfect segue, actually, Heather, to the next slide. That we hear from stakeholders, just like Candace and Melvin are saying, we hear from stakeholders that it's a sign of respect when researchers have done the work to prepare to engage communities. Researchers would never start to do a research project without a literature review, but how often before researchers or other institutions or health providers are engaging communities, do they put the same investment into learning about those communities? So we have some questions again and we welcome you to participate in this chat about this as well. What do librarians and researchers know about communities impacted by the research that their institutions are conducting? They, as Candace was mentioned, like, how have you gotten to know the places where community research partners and participants live, work, play, worship, community leaders and dynamics and power relationships and history? And, you know, going back to some of those questions, like, have you thought about what the community experience has been or might be of participating? Do you know the history of your own institution? Do you know the history of your profession, the history of healthcare and research, especially in communities most impacted by inequities? And also communities want, another part of preparing that we hear a lot from stakeholders is, how have researchers or others really thought about themselves? What do they know about themselves before participating? Really reflecting on your identities, your positionality, your biases, your privileges, and what kind of context that will have on engagement. The community context, that broader context for things that you might be focusing on, root causes, that sort of thing. And also really thinking about what is the approach, what is the way, what are the strategies that you would use to value lived experience and expertise in the work that you do. I'm going to open it up to Melvin and Candace, and I'm also dropping in the chat. This is a resource from our online resource directory that digs into this preparation to engage for researchers or other institutions that might be helpful.
Oh, definitely, definitely. You know, and it's something like you have to think cultural when we're thinking about health, right? There's a respect model. You know, you have to think about what as shared here, the lived experience, that the community has experienced, what trauma has the community gone through, understanding and, giving cultural relevance and it's all about attitude, right? It's about, not having any preconceived ideas and notions when you're dealing with certain communities. It's the bias. And then there's, understanding that you may have to devote time when explaining your research. It may not be understood right away, or it may not be accepted right away. But if it's something that's important to you, and it's something that without a shadow of a doubt is helpful to that community, then empathy and patience is definitely something, because you have to remember historical nature of communities of color is not trusting. So they're going to be pushback. There's going to be pushback about your research at times, and there might be questions like, what, I don't know if I trust it. I don't know, if I think that it's something that I want to do. But it's something that I always say, if they say no today, then back off, don't push. Say, I appreciate you and I appreciate your honesty. Let's try again another time. Can we reach back out to you at a later date that maybe you might be more inclined to listen or to be more receptive to the information that we want to share? Because, you sometimes you kind of push people away when you're like, oh no, but this research is good for you. Well, that's what they've said before, right? That's what they said about the Tuskegee experiment. However, we know that wasn't true. So you have to think about what experiences the community has had when you are talking about your research. And then you have to think about too, is this a power play for you? Or is this a power play or power move for the community? So giving space for the community to listen and to come back to you, that's giving the community power. So that's you taking the power from you and saying, you know what? I understand and I value how you feel. Let me know when you feel as if this is something that you would like to discuss at a later date. So that's a power play, being empathetic and then listening to the concerns and fears and validating, because it's like anything else. We all have our own, thoughts and ideas of things that have happened and things that we've had personally. So these things are valid. Just because they don't pertain to you doesn't mean it's not valid. So, respecting that. And then lastly, trust, building that trust, allowing room for acceptance and patience and understanding and giving up on the power to, the community, is building trust, because that means like, okay, you know what, we're not going to push you, but if you don't feel comfortable, let's reapproach this another day. And so that's giving the opportunity, but then also staying engaged, staying in communication, making sure that if there's anything that wasn't understood, you're available to explain. And if it means you have to explain it 5 or 6 times, guess what? You might have to explain it 5 or 6 times. But that's how you build that relationship. And that's how you make people feel comfortable with what it is that you would like to do.
Yeah. Ooh, man, that's powerful. Man, that stole all my thunder. So one of the cool things you can do as a researcher, I mean, is you can cheat. You can Google a neighborhood that you're going into, right? And find out what's going on. I mean, if there's a transit line that's supposed to be, that's been, long time coming or something like that, a lot of controversy, a lot of back and forth, find out what's going on in the community just by Googling. And believe me, you will spark interest right from the start, right? And you get people talking. Now people want to stand up and speak for an hour, and you got to cut them off. But at least, now you've gotten their attention because you've done your homework, right? You don't have to be an expert, and everybody will know that you're not from the community, but you came in and you served a topic that that there's some passion around, right? And so it's just amazing how far that'll go. And one of the things I enjoy about working with my research colleagues is when I see they'll start using some acronyms, or might say something like a biomarker in a community, and community members are like just kind of got that far off look in their faces because they don't know what you're talking about. I get to be that bridge and say, hey, Candace, can you kind of break down what ARCC means and what a biomarker actually is? Yes. And then the researcher breaks that down, and then you get the community, you see the heads nodding. And so now you're making connection, because you don't want to be speaking over, even though you're well trained and you know your business, you still want to speak English, right? Mm-hmm. You still want to communicate to the community, so you're getting the kind of feedback that you're looking for. I love that question about institutions knowing about themselves, because I've done extensive work with libraries probably the last 6 or 7 years. And one of the things that I was struck by, but not so surprised by, was the percentage of academic librarians in this country hovering around 90% white. And that steps have been taken since the 1930s to diversify that group of people with very little success. And so here we are. I know our regional library has taken major steps to bring more minorities into the space. And so I wonder sometimes if academic librarians are aware of the barriers to a diversified workforce, and has that even appeared on their radar, right? In terms of how they go about their work, knowing that their population isn't reflective of the true population, right? And I kind of pulled it up. There's some research that says that the reasons and the barriers for that is institutional racism, right? Or lack of commitment for change and accountability, and all of those things. We've all been watching, the judicial hearings, right? And look at the landscape as a point of reference. All white men for the most part, right? And so this is a spectacle because the lack of diversity is so, it screams at you, right? And so when we see these firsts that happen in our community, you have to put those in the proper context so that when you are engaging a community, you have that historical context to operate from, knowing that this is an issue that is in real time, something we're still dealing with, right? And so just having that open-minded perspective on how you approach your work will be monumental in your success.
Thank you, Melvin. And do you want to share a little bit now too about the collaborations with Andaleo and the community libraries?
Yeah. I can share. You know, when I first came into this position as executive director at Andaleo, there was a glaring regional library that you see at that little picture right there that had fallen into disrepair for maybe 2 decades. And it's in our community. It's the anchor of our community. It has 27,000 people that come through the turnstiles on a monthly basis. That's huge. And it had fallen into disrepair. Now, keep in mind, there are only 2 regional libraries in the city of Chicago, one on the north side in the mostly white communities, and then one on the south side that happens to be in our Washington Heights community. Yet our library, contrary to the pristine condition that the north side library had, was, you know, literally falling apart with scaffolding around the building, you know, for decades. And so when I came into this position, I looked at that as a bellwether, as something simple, something significant, and yet salient to the community that we could rally around, because for lack of a community center in our neighborhoods, that library serves multiple purposes. So I knew that it would resonate with our community, and we were successful like $10 million later in actually getting this thing done. So what started as a community development project simultaneously turned into a health information hub, because dementia, and I think it was mentioned early that we created this dementia-friendly space inside of the library because we found that dementia and Alzheimer's disease was running rampant in the African-American community, like a ratio of 2 to 1. And so this was kind of like startling news that was happening in our community. And so we reached out to researchers, namely Northwestern University, and said, we have a crisis that's silent in our community, and we need some assistance. We need some help. We need some guidance and direction on how to address what we would later learn is an incurable, accelerating, deteriorating brain disease, right? And so we've partnered with Northwestern University and others, the Alzheimer's Association and others around programming, all kinds of research and partnership grants to form coalitions. We have a Woodson Library Health Advisory Board now that does monthly programming to engage caregivers and educate and make them aware of what they're actually going through. And so I relish community engaged research as a platform to the 3 program areas that we work in health, education, and community development, because it's wonderful for Melvin to stand on a soapbox and say we need nutrition in our community, or we need better awareness or pharmacies or whatever the deficit is in our community. But then when you have a community partner, right, a highly trained researcher, scientist, health professional, you know, guiding you and speaking alongside of you as a partner, it gives you credibility, it gives you validation. I mean, it has been an amazing partnership that, again, we really have rooted our community-based organization in this kind of research. And of late, we recently, I recently joined the Muslim Center at Northwestern Medicine as a community advisory board member to their clinical and translational research, because very few of us in our community are researched, right? And participate in clinical trials. Interesting note, a few years back, we showed a play in the community about Alzheimer's. An African American had written this amazing play, and we had hundreds of people attended. And during the intermission, we took a poll about the need for African Americans to participate in clinical research. We got, I think, in one intermission, 98 people to sign up and say, hey, I want to be a part of this. I want to know if I'm susceptible to this. I want to know if it's genetic. I want to be part of this study. Sadly, after all was said and done, and this is a policy issue that I have really come to respect policy now, the policies that prohibit people from participating in this clinical research for whatever reason, medical history, just a litany of different things. Only 4 people were able to participate in that clinical trial. 4 out of 98. So I got a chance to speak in DC, and I think Jen, we were out there together, and I shared with the National Institutes of Health that if you're intentional about getting our community to participate, you're going to have to lower those barriers and make accessible the opportunity for people who don't trust you in the first place, right, to make themselves available to these clinical trials, so we can get a real concrete study of, you know, what's going on in our community and be more precise in dealing with our population as such. Because, right, you know, certain medications we know affect people differently. And so the more we can do that, the better off we're going to be from a you know, a population standpoint. So this is really a critical area, and it really for me opened up the floodgates to why this research is so important. And because of the historical context that I mentioned earlier, I pull no punches in terms of speaking to the medical industry and, you know, the health industry about what you're up against in terms of skepticism and cynicism and the trust that is ongoing. And even today, we still hear the kind of things that are, you know, I mean, the whole vaccine thing. Is it any wonder that communities of color are adamant about not getting a shot, right? We only can look at yesterday, and it wasn't that long ago with Tuskegee and all those things. And so, you know, researchers may shake their head and say, well, you know, why wouldn't someone get a shot when this could help save their lives? Well, okay. let me Google something for you and show you why. And so it's just keeping that well-rounded perspective on your work is only going to enrich what you're doing, because this is not going to be solved overnight. Didn't happen overnight, and it's not going to be solved. But what you can do is make inroads to better understanding of yourselves and the people that you purport to serve.
Thank you so much, Melvin. Such rich information shared, and a perfect segue to some conversations that Candace is going to talk about next, that we've been having specifically with health and research libraries about their role in kind of telling those kind of histories, fuller histories, and that too. And you know, you're getting, all of you in attendance, you're getting an absolute masterclass. but it is going fast. We started a little bit late, so I'm just keying my friends Melvin and Candace into our time too. But we can go to the almost the end, because really the next two slides are really like the meat of it, and then we can share the rest as resources too. So I'm turning it over to you, Candace.
Awesome, awesome. In conversations that Jen and I have had, it's one of the things that we're finding is that a lot of institutions are not aware of their history, and what role they play in equities. And some of the things that I've been working on lately has a lot to do with healthcare inequities and the roles that institutions play, and the red tape that institutions internally have that contribute to the inequities, right? Because a lot of times these things were put in place well before you may have started working there and before you became a part of that institution. And so the institution is complicit as well as, outside of the institution, right? So when we think about the inequities that we have in healthcare, the healthcare system was designed in the first place. It was equitable when it was created in the first place. And it wasn't until the civil rights movement that we had desegregation in healthcare, and it was only because of the federal government and Medicare and Social Security. So when we look at that and you think about the time frame of that, we're in 2020. That wasn't that long ago, and so you have to ask yourself, what else is there historically that can be shared, that's in the libraries, that has a rich and vast history of things that have gone on long before you and I were here, but also it talks about the rich histories of the institutions that we may not have known, who, in addition to, who the, outgoing chaplain was and who the incoming person was, but what role did your institution play in supporting or not supporting healthcare inequities and into the systems of racism, structural racism, institutional racism? What role does your institution play in healthcare? And so there might be unspoken heroes, and then there might be unspoken demons. So we don't know that. But the whole point of it is that there's rich history about institutions that have not been told. And so often we don't know what the history is, and we're uncovering, great amount of information that's like, wait a minute, is this what this institution was founded on? So, so it can be such a challenge to explore, but then you want to explore, right? Because if there's a way to affect change, if there's a way to make a difference, it is something that's within your institution, because you can probably get, it's just like we have laws on the books that happened many, many years ago. And these laws are still in effect, that we don't, like yesterday, we just signed the anti-lynching law. How, really? In 2022? So, but then you think about what other things are on the books. And so then you have to think about, what has our institution been involved in? That we're not aware of, what things are still on the books that are not valid. And so that's talking about, race-based medicine. So these are things that are it's important and it's pivotal, because it can help us find our way to what we keep saying. We want health equity. We want to have, institutions that are just, for all, medicine for all, right? But if you don't know the history of your institution, how can we have medicine for all? Because that's a big role too. That's a very important, where have you come from? So I'll stop, Jen, and see if you want to add something to that.
Well, I was just going to say that, so we've been having conversations at Northwestern and Chicagoland with, history professors, librarians, at the health library, archivists. And part of this really goes back to the principles of engaged research, because also in the writing of this history and the telling of these stories, whose experience is being centered? Whose voice is being lifted. And so we really are interested in hearing from you and coming to you with a conversation as librarians and researchers as to like how can, what is the role of libraries in this, and also doing it in a community engaged way. Are there community archives, are archivists, are community stakeholders being trained to do this work in concert with, librarians and health archivists? Are there oral histories of patient experience and community member experience related to the stories that's often told institutionally? So this is work that we haven't done yet, but are just having the forming conversations, and we're excited to hear about how others in this field are thinking about it, because we think it's a powerful area, especially because, as Candace was saying, we cannot move forward on some of this work related to inequities without this acknowledgement and understanding where we're starting from, and not just where, as institutions, we can't answer the questions about what has the experience of community, what impact has our institution had, or what harm has our institution wrought. That can only be answered by community. So if we're writing these stories without them.
Definitely.
Did we mention this is messy?
Yes.
This is messy.
It's
complicated. It's like you might be reconsidering your career. Might be a few people dropping off the call now, but it's the necessary work. So that's all, and it enriches us all. There was a segregation study done in Chicago by a planning agency a few years ago, and it just showed the data of how all communities, and we're talking about probably the most segregated city in the country, in the world, in Chicago, but how segregation, because we're referred to as a tale of two cities, but how segregation actually hurts us all economically across all races. And so this is why this work is so necessary, because it's going to yield so many positive things across, just across the entire spectrum. So Jen, take it away.
We want to also make, there's only been one comment, and we can, and I think it relates to what we were just talking about in the chat about, when we talk about representation in research and in libraries and others, that, and you both brought up points about that, about how sometimes people may not feel safe in academic spaces. And I think some of the issues that both of you have raised, get to that point. We also want to have, a chance to, have more questions and back and forth. But we wanted to, community engagement plays a key role in, we believe that community engagement plays a key role in addressing structural racism in the healthcare system and in research and health libraries. And so we wanted to ensure that we brought that up and make sure, again, that communities most impacted are those that are centered. I want it. We'll move to the discussion in the chat and the questions that I see coming in. We're not going to go through the rest of the slide. Actually, could you just move to the next slide, Heather? And then I hope that the rest of the slides will be accessible to you as symposium members. They aren't ones that we want to go through today, but they have resources, hyperlinks to, as you engage in this work, visualization about strategies, how community engagement is incorporated, different mechanisms and what that looks like. And again, our contact information. So I want to make sure that you have access to. We did also want to make this point that a lot of times engagement gets talked about at the level of an individual research project, guiding that, getting diverse participation in the research participants, recruitment, things of that nature. But that engagement, as we've been talking about, is nested in all of these systemic and structural contexts. That it's not just about, it is you as an individual, and it is also the departments, the centers, the institutes that you're in, the schools, the university, the funders, professional associations that make up the entire research enterprise, and that we acknowledge that the types of shifts that we're talking about cannot be done by just individual researchers or individual librarians, but really require shifts at these different levels. So we just wanted to make sure we raised that too.
Hey, Jen, I wanted to respond to John's excellent question about the creation of community advisory boards in communities. And I think it is spot on. Absolutely, I endorse it. I'm on countless and probably too many community advisory boards, and it extends across the country. And I will tell you that not only are they highly recommended, but my experience has been, I'm happy to report, the deference that has been shown to community voice in those rooms, right? And so there's always an intentional effort and a concerted effort to make sure that in those rooms, the community voice is the loudest. And so, because the institutions are the ones that are trying to, dismantle and deconstruct what's been in existence for so long, and they need to hear, maybe some things that are going to be uncomfortable. But at the end of the day, there will be a richness and there will be change in the way things are. I mean, just my experience at Northwestern, it's incremental, there's pushback, there's conversation, but at the end of the day, we're happy that we're all there, right, at the table. And so I highly recommend that, and make sure that board isn't too research top heavy, right? And that you've got more individuals from a cross section of community at that table, and that they know that their voices are the preferred voice that needs to be heard.
And I'll add to that, being a committee member myself and advisory board on several, it's like Melvin, I think we're serial about the work that we do. When creating a community advisory board, you want to make sure that it represents the community. Because there's nothing worse than having a community advisory board and the people that are making decisions for the community on that board don't live in that community, or they're not affected by the policies created by that community advisory board or the work that the advisory committee is discussing. And you want to make sure that the priorities are in alignment for the community. And so then one of the things that I strongly recommend when I'm, especially with hospitals, when you're doing a community health needs assessment report, that community health needs assessment report, and I'm a stickler for this, should not be a community health needs assessment report of people that come to your hospital. It should be of people that are in the surrounding areas of your hospital, because that represents the true need. Not those that come into your hospital. That is not a true. So there are often times where I've had to challenge reports, CNH, community health needs assessment reports, because they don't adequately reflect that community, because they have done a report based upon who has visited that hospital. That is not how, that's cheating. That is not, because it's not reflecting the true need. And if I'm in that community and I'm saying, and a majority of people in that community are dealing with mental health, struggling with mental health, but yet the people that are coming to your hospital are saying that they're struggling with transportation, then it is not adequately reflecting the needs of the community. So when it comes to things like that, that voice matters, your voice matters, and being able to fight for the community and what they say they need, that's what matters. That's what's important. That's why we're on that board, because we want to make sure that we're living up to that and we're holding those that are in positions of power accountable.
And there's nothing worse than being on one of these community advisory boards as representative of your constituency, and then something in the newspaper comes out about that institution that you're working with, that they've done something blatantly silly in the face of this, and just the bureaucracy of the size of an institution, these kind of things will happen, right? And so someone from your community will reach out and say, Melvin, did you see that? They're actually turning African Americans away from emergency rooms, right? And it's documented and all these things. Well, I've got to answer to my community. And so you best believe I'm going to bring that up in a community advisory board meeting, so the powers that be know that this is an existing situation in our community that's troubling people as we're trying to create this new platform, right? And so things happen in real time that I think it's a positive that you get to deal with literally while it's happening. And quickly, Candace said something about, making sure that community members are on the board. Don't take that lightly, because we have a transit situation in our community right now. And the head of the Chicago Department of Transportation made a statement in a meeting that they had met, and they've had all these community advisory board meetings, and 96% of the people there were transit officials, planning officials, local officials, and about 3 residents, right? And so that's not representative of the community. And so, a lot of checking the boxes happens in these community advisory meetings. And so you have to be diligent about why you're there.
Okay, guys, I am so sorry that we got started late, but I have to wrap us up now. The slides will be made available, and the recording will be made available also. It'll end up on the website, the conference website, and I don't know if it'll be later today, but probably by tomorrow, for 30 days. And then after that, it will be moved to the NNLM's YouTube site. So thank you so much, Jen, Melvin, and Candace. Again, I apologize, we got started a couple minutes late. Technology, you know how it is. Everybody, please stick around for our closing keynote, which will happen in just a few minutes. And the contact information is here for Jen, Melvin, and Candace to reach out to them with further questions, because I wish we could have had like 3 hours to spend with these folks. This was fantastic. Thank you all very, very much. Have a great rest of the day.